way, a first list of schools where there's at least one case since the schools opened, and that will be published around 3 p.m. today. And the reason why we're not able to put all that on the website, because we will be doing that next week, we pledged to do that, is that there's a lot of interface, if you will. I mean, it's kind of an excuse, but I prefer to put out documentation that's clear and correct. So the fact is the parents send the information, the school receive the information, there's a confirmation by public health that this is indeed a case. We put that on a website, and that's quite a lot of work. We're talking about the first few days here, and I think we're extremely prepared. But this afternoon at 3 p.m., we will have the list of the schools that are affected where there's been at least one case. And we will not necessarily talk about the whole number of cases, but if there are, I'd say there are about 30 schools involved. But the good news is the very limited number of cases per school, either a teacher or a student. So that will deal with the schools, and we'll be working on this in the coming days in order to improve that information and putting it on the website with greater detail. Now, the third item, and I talked about statistics, I talked about the schools, and I'd like to come back now to my third point. Can parents do anything else? Well, I think we need to work with our various associations here, because our associations, whether they're unions or teachers' associations, I mean, everyone is finding it difficult right now. And I won't go into detail, but I think we have an opportunity. And you know, we've seen people come forward with innovative solutions in the schools, and I think if we continue with that, the greatest satisfaction we will have is seeing our children in school. So that's it for the schools. Now, there were some journalists who were very well informed and heard that we would be coming forward with a level of alert within the next few days, an alert system, if you will. And now that's your job, and that's fine if you were able to find that information. I must say I'm somewhat guilty for that, because I did talk about bushfires and so forth, and I said we needed a system. So it's really my own fault. But the reason we're going to have a specific press conference on that is and that will be taking place next Tuesday, at the beginning of next week, as we regularly do at the beginning of each week, is that I want to be in a position to talk to my colleagues and to our partners. Now, we have well-defined the way we should structure the system. You know, when you're walking through a park in Quebec, there are signs saying, well, you're in this area where it's red or green or whatever. And the alert system will therefore be regional and sectoral. And I'll give you all the details on that next Tuesday. Right now, we're looking at possibly being able to give a technical briefing to reporters prior to that, just to give you the time to get that information and ask more specific questions during the press conference. Now, why do I want to have a bit of time? And I think that with public health, this is an important document. And what I want to say to you today is that I hope we won't have to use it. If we keep the number of cases very low, we won't need to change our alert levels. We won't need any of that. So Tuesday, we will look at this in detail. But right now, what I'm doing with my colleagues, both at the economic level and elsewhere, is to talk to colleagues and say, look, if we need to use it, what are your comments? So over the weekend, we'll be talking to a number of people. about how it will apply. And this is pretty much what we did when we were talking about lifting restrictions or bringing in a lockdown. I always talk to my economic colleagues, and we're doing the same thing in the health sector as well. We're going to be talking this weekend so that we can present something to you on Tuesday. And I did make some calls this morning, and I can tell you the reaction of people was positive. So I'm just asking you to be patient, and I know that as reporters, you like to ask questions, and you'll want to ask questions today, but the information will come on Tuesday. And my final point is this, and it is related to statistics. I just want to be certain that I repeat what is going to be happening over the weekend. Now, you saw yesterday that we had 19,000 tests conducted, and that is really a record to date. However, our testing strategy right now is very targeted, and we're asking people to volunteer to be tested, and therefore it is quite possible that the results over the next days will continue to go up. We're at 184 today, and it's quite possible that over the coming days that number will be higher. That's not really necessarily a concern for me, but I just want people to understand what that means and to understand the context in which this is happening. And that means it's even more important to have the plan that we're going to be introducing to you on Tuesday. But I just want to close by saying this. Please do surprise us over the weekend. Surprise us over the weekend. Whether we're talking about restaurants or private parties or family parties. That's why we wanted to talk to the people of Quebec today. You really have to be very careful over the weekend. I know that everyone is fed up, and I believe that the long Labor Day weekend is a weekend where we get together and have fun. But at the same time, I think we can say to Quebecers, please surprise us by following the rules, even though I realize it's not always easy. So I'll stop there, and I'll make a few comments in English now.
Just say that we are at the start of a long weekend, Labor Day, the Labor Day weekend, and this is, I think, what good time to go over certain points. I'll be brief, but I've made the habit of presenting the cases that we have in the last few weeks, and unfortunately, I should not show it upside down because the graph improved, where right now it doesn't improve. So you can see, and I think you'll see that on our website, that the cases are increasing every day, and this is not good news. We even hit 187 yesterday, 184 today. This is not good. So, and what it means is more cases means potential more outbreaks, and that's exactly what we don't want. So those outbreaks, they are a danger, and this is the reason I said in the last few weeks. Why? Well, because they are a danger for our schools. They are especially for healthcare workers, but also for our seniors. So together, I think we have to put a stop, a really hard stop on those growing caseload. And I think this weekend, especially for Labor Day weekend, I would just ask everybody to pay special attention the way you meet with your neighbors, you meet with your family, and I think that's very important to make sure we keep this on a very slow numbers as opposed to what we've seen in the last days. Now, with the school update, this is important. With our children that are back in schools, we have to be very, very careful. We knew that we were taking that we would have some cases when we would to open the schools. And it's not surprising that we have roughly about 20 cases in about 25 to 30 schools, and I'm not being very precise because we will announce this afternoon around 3 o'clock the number of schools that have been affected. But I think in perspective, we have 3,000 schools in Quebec, and we have 25 schools affected in the last week. So I think this is really under control, and we need to continue that way. But as I mentioned in French earlier, we will have additional information on our website in the coming days. So I think this covers my point for today, and we will open the floor for questions.
Donc on va passer à la période de questions. Juste vous identifier, on va se limiter à une question et
one question and one follow-up. Good morning, Mr. Dubé. You talked about the number of cases. You said that it's going up quickly. We've gone over 20 cases per million. That's what you said earlier. We are at an important alert level now, and yet today you're not changing the instructions. This is the last weekend of the summer. There probably could be more infections. Why are you not changing the rules today? And what is the limit for you? How many days or how many cases will it take before you change the rules? Well, that's exactly what we're going to be talking about on Tuesday. But what I'd like to say, and I'll let Dr. Massé complete my answer, but I'd like to say one thing to you. Remember that when we began to present the figures a few weeks ago, we said, look, you shouldn't only be looking at the daily number of cases, but actually looking at the moving average. So for those who have been following on Twitter, every single day I give the number of cases, but I also say what the moving average is. In other words, over the last 7 days, we look at the number of cases because you can't just look at 1 day or 2 days. And right now, our moving average is 140. So for me, it's not 180. And the second point, and I'll let Mr. Massé comment, is that there are other factors to be considered. So I think that Tuesday we can take more time to discuss this. But when I see 187 and 187 that would remain the same over several days, well, then I want to be sure that in the next few days and on the weekend we can work to change that. I'd just like to give you a concrete example of a region where there was an increase like that. Now, first of all, there are 4 different levels. I think that's already been mentioned. Well, actually, there's less and less news to announce on Tuesday. Well, the fact is that first level is a level where we intensify our current response. And among the responses in a region where there's been an increase, it would be, well, number one, we want to ensure that there's more testing done. Second, we want to facilitate in an area where there's been cases, the ability of people to be informed of what is going on. And third, we disseminate information to those places where there's been more transmission. And that can be done via various channels, social media, and so forth, so that individuals can get that information. 4, measures that involve individuals and the idea of contacting people who could be affected quickly. We also want to use inspectors from the Ministry and Public Health who will go into those areas where we've identified transmission to investigate. And if it's necessary, and it was necessary in the region I'm referring to, there were places that were closed temporarily. Sometimes it was the facility itself that decided to shut down, and in other cases it was Public Health or the Ministry of Health that demanded that happen. So as you can see, these are different responses that we engage in when there is an increase in cases, but we're a lot more proactive, and it's a lot more massive a response. So we're not talking about a level where we're going to lower certain social activities, but we want to get a message across. And as Mr. Dubé said, and this is a very important message, is that when the schools reopen, and as they have, we've seen an increase in cases. So in the case of the schools, and we're talking about primary and secondary mainly, the fact is that when you get to the university or college level, you really have to be careful. And people are in the habit, and we've all been students, we understand that. People want to go and see their friends, they want to celebrate and so forth. But this year is different. This is a year where people have to be cautious. And there are parties happening. I mean, if you get together in a park, well, you know, the fact is you have to keep a 2-meter distance from your friends or from others. I mean, those are things that can be done, and there are lots of positive examples. So people have to think of that, not only in Montreal, not only in Quebec City. What we're seeing are cases in a lot of different regions right now. So it's people right across the province that have to take those precautions because the return to school affects everybody. So special precautions are needed now, and unfortunately, those initiation parties are dangerous. So it's a special message we're sending today. Yes, I want to come back to initiation. We have been informed, because we've been following this closely, that there are initiation parties that are planned right now, and I am clearly asking the people responsible for planning those parties to review that and cancel them. Because I would not like to see us end up with a case like the one in Quebec City. And thank you, Richard, because this morning at our usual meeting, very early, we understood there were a couple of those parties that are planned with a large number of people. And I repeat, that must not happen. It's very dangerous. Yes, good afternoon. I'd like to know when we're going to be doing preventive sampling in the schools. Now, over the weekend, will you be testing a certain number of students in the schools? What is your plan? Well, for some time now, we've been looking at this and assessing that technology. We asked the Public Health Lab to do some assessments with respect to the various tests that are available. And the first results that we received were, how could I put this, mixed, in the sense that we didn't have the reliability that we were looking for. Even though it's been used in certain American states, we were thinking, well, given the lower reliability of those tests, we should maybe wait a bit. Now, the most recent results that have not yet been published, but that have been discussed in the media, show much better results than previously. So we think that we should be able to use them soon, but soon, I mean, we can't give you a specific date. First of all, we'll publish the results, but as quickly as possible, and the best possible, because it's not easy to use those nasal tests, but we will be able to use them, but we'll be able to use those new tests, but in some circumstances we can also continue to conduct the other testing. So very soon we'll be able to do that. We're almost there, and I want to congratulate the Public Health Lab in Quebec City that's been working with other labs and facilities to do that assessment and make that accessible. So you can't give us a timeline for that? I don't have a timeline because I don't want to give you the wrong information. I can tell you soon because the results we have suggest that it should be useful, but once again, there is room for various types of testing to be conducted, and we have to have the equipment as well. It's fine to say that the test is reliable, but we have to have the needed equipment. So it's very soon. Now, certainly, the children don't like people using swabs in their nose, but there could be differences in the sense that some people will need a more specific test done, but we will mention all of that when we're ready. Yes, good afternoon. Without pointing fingers, I think that we're talking about a situation that is associated with certain families who got together, including the family in Laval, the 14 people infected at a family gathering. Were they outside? Were they following the guidelines? Will there be fines imposed? Well, I don't have any specific details as to where that occurred, but I may be able to get them later, but I don't have them now. in terms of imposing fines, I think it's not just information that we receive through various channels. We have to have an observation of what happened to have occurred. Now, if we see that some people within a private residence or in the backyard of a residence violated the rules, yes, then there could be a fine imposed. And it's a significant amount of money. So in the cases that we're talking about here, I don't have the information. But if people do that, and if they are seen to be doing that, then the police will respond and assess the situation. And at that point, there could be a fine. Ms. Guilbeault said that she was calling on managers to let people know where there are violations. And don't you think it's time to ensure that residents and citizens are also called upon to be responsible in such cases, not just the managers of certain facilities? Well, we're currently looking at all of that with Ms. Guilbeault, because not only does there have to be a complaint, but we have to have the means, the practical means to respond. So if a police officer goes on the scene and you've heard the expression, keep your distance, keep the 2 meter distance if possible. So we may have to change our terminology somewhat so that if we're talking a more yellow situation as opposed to a green alert level, we will allow our police officers to take action, which is not really the case right now. So we're looking at that, and that's why we're having discussions with our partners before we make an announcement on any necessary measures. Okay? No, well, we're dealing with that right now, because if we're announcing the program next week, we have to be able to act. You've been talking about the fact that there are people getting together outside at barbecues. Sometimes people are meeting inside. But on a great, beautiful day like this, it's starting to be a bit cooler. Now, in the fall, are there any plans to change the rules for people meeting inside if COVID is still with us? And how can we ensure that there will be an incentive for people to follow the rules? Well, there's no plan at this time to change the rules for private residences. There are a lot of different potential scenarios, either inside or outside. There's no plan to change the rules in that area. And I know that we're repeating things that have already been mentioned, but it's a good idea to do that. Where there's an important risk is when people are close to each other, and the fact that people are, in the common areas where there's little space and are close together. So it's a very delicate situation, because now people will be moving from the backyard into the house as the weather gets cooler. So it's more like inside public spaces that are particularly important, and there are discussions now as to whether those gatherings can take place. And there's really an issue when it comes to distancing. When people are inside, can we ensure that people can practice safe distancing? Now, it could be in places such as this or in much larger facilities. And based on our experience, things seem to be going well, but we will be assessing that to determine whether it's relevant. Now, when we're talking about people outside, the social distancing still applies, and we're really asking people to be careful here, because there were demonstrations, and we're not against demonstrations, but of course these are events that are dangerous when it comes to transmitting COVID-19. So there we really need to be very careful. And in a period where we're seeing a bit more transmission, where we know that there are activities starting up again, economic and social activities, and that's normal and healthy. We're talking about a new normal, of course, but the new normal remains in place, which means that our social and economic life is starting up again, but we have to reduce the number of circumstances or times when people are getting together, and it can be dangerous. So Now, when there are a large number of people inside a house together, that can be dangerous. Inside a public place, if it's properly laid out, that could be okay. But people have to respect the rules. And people learn. We saw at the beginning when we started to see people gathering in parks in Montreal and elsewhere, and there are lots of examples we could cite here in Montreal or elsewhere. We saw people initially not following the public health advice and getting together as if there were no rules, as if there was no problem. And then we saw people getting in the habit of seeing each other, but in smaller groups, and ensuring that they put the proper barriers in place, wearing a mask and keeping the 2-meter distance from others. So, yes, we see things changing, but inside private homes, that remains an important issue and a risky situation where people really need to follow the rules. Now, inside parties with 25 people, it's really not a good idea. In fact, it's forbidden. Over 10 people, yes. 10 people, 3 different families together, yes, it's prohibited. No. You have ruled out using the public alert application. Has your mind changed on that? No, it hasn't, because if we decide we need it, we will do so in the coming weeks. But right now, our teams are working to ensure that if we need there to be a connection with the current provider, or whether we deal with the current provider or with another provider. I mean, in an ideal world, we would prefer it be a Quebec provider. But as I say, we want to have it when we need it, and we have a team that's working on cybersecurity and ensuring that personal information is protected. Thank you. Good afternoon. With respect to the cases in the schools, I heard you say that the list will be published at 3 p.m. today, but at this time, are there only single cases in all the schools you've identified? Or are there cases where you consider it to be an outbreak, and does that mean some of the rules should be reviewed? Well, overall, because I want to be cautious on this, I repeat, we're talking about 3,000 schools that have to produce a report every day, and consolidating that information, collating it, can be a challenge. But the fact is, there are cases, and I'll let our expert refer to this in a minute, but we're talking about the comprehensive school where there was more than one case, a teacher who had an impact. So that's why I'm cautious here. I want to be careful until the list is published this afternoon. There were 2 situations that occurred. One was a preschool, because it was during the preparation period for the return to school, to the comprehensive school. I don't know whether I should mention the name, but it's one near Montreal, let's say. And there was a case of one individual who is part of the teaching personnel who didn't realize that he or she was infected. And what happened was that a number of colleagues were also infected. And one of the consequences was that teaching staff were inadequate. There weren't enough teachers on site, and there was no one to replace those people who had to leave. So you can see what the risk is just between colleagues when there is a break of some sort and there's transmission. That's the problem. And I mean, it's a problem for the students as well, because there are a lot of people who are affected. There are parents who are also affected and so forth. So there aren't many cases, as I said, but there are important consequences when there's an outbreak. We may have to remove students from the classroom. We may have to ensure that people can self-isolate for 14 days. And so when there's an outbreak, when there are a lot of people infected, then there's a different response, a more extensive response, and there's a lot more activity involved. So that's true for the class and the classroom, but also the interactions between various people. So right now there are very few, but as I say, these are things that we're following closely and we respond very quickly. Now, we're talking about an information system to ensure that we're providing telephone numbers so that people can get in touch very quickly. And that's important because it's a question of hours. You know, as Mr. Dubé said, the transmission happens very quickly, so we have to respond very quickly as well. No, apparently there's a tremendous delay in the number of surgeries that are taking place. 92,000 have been postponed. Do you have a plan to resolve that? Well, not only do we have a plan, but we've already started to deal with the problem. We're very alive to the issue. And in the last 6 months, and we're talking here about less urgent surgeries. I'm not saying they're not important, but they are less urgent. And we accumulated quite a few in recent months, and we know that we have to find a solution. So what we began to do, and we've been discussing this, we had to find private clinics to deal with some of these surgeries, and we have to have specialist physicians who can operate. The second issue is that sometimes we have the operating rooms that close too early, like 2 o'clock in the afternoon. So if that happens, then of course, they can't complete the necessary number of surgeries. So it could take some time, but we're working on this. And I said this earlier, and I'm sorry if I repeat myself, but the fact is that before the pandemic, there were about 40,000 surgeries per month happening. Now, if we want to catch up on the 92,000 that were postponed, we have to do more than 40,000 a month, and we have to find solutions. In the case of private clinics, a number of agreements have been signed on that. And I'd say that there were some clinics that were asking for large amounts of money, and we're continuing our negotiations with them. And I believe there were some compromises that were met in recent weeks. So that was one of the solutions. Also, the opening hours for the operating rooms so that there's more access to the operating rooms, and we're working on that as well. Le devoir. Now, in terms of the list of schools, is this a temporary list? Will it be withdrawn or replaced as the statistics are updated? Well, nothing will be withdrawn. The list of schools will be published regularly, every day. We said we would give you something this week. So the first list of all the schools that had a case since the schools reopened will be published today. Now, in the coming days, and we're working on this, and there are people who have been working very hard on this in the last week to ensure that we're collecting the information from the 3,000 schools and the service centers and so forth. I want the list that we're publishing today to be on the website as soon as possible. That's what I'm saying here. But in order to abide by our agreement and be as transparent as possible, if people didn't receive the letter, or if a neighbor says, well, how is it that my neighbor got the letter but I didn't get the letter? Is my school on the list? So that information will all be available this afternoon, and we're trying to provide even better information in the coming days. But what's important for us is not to make people, to increase people's anxiety. We don't want to tell people about cases that haven't been confirmed by public health. So we've had a great return to school. The number of cases compared to the population more than 1 million students are in primary and secondary school. And to see this limited number of cases means that we've been successful. But at the same time, we want to publish that information for people to be able to access it. It's important to properly clean the microphones. Yes, so we should not see people passing the microphone back and forth as we've seen in the past. And thank you for the work that you're doing. It's very important to clean those mics. I'd like to have additional details about the information about what's happening in the schools. In addition to the number of cases, will we know the number of classes that will be quarantined? What kind of information are we talking about? You know me, I like data, but at the same time I need to be practical about this. I would have liked to give the number of cases per school, but if there's only one case in a school and we know the school and people in the neighborhood say, oh, which little girl is it? Which little boy is it? So right now we're looking at that whole issue. We're looking at as well whether we could publish, and these discussions are ongoing, but we're going to try to look at the number of classrooms that may have been shut down and so forth. Now, what happened in recent weeks is that all the schools that fill in those 3,000 questionnaires, I mean, we look at the information coming in and we look at what's relevant in that. Now, as I say, the most important thing for public health is to be able to respond quickly and to inform parents. But just give us a few more days to get this straight. But today we felt it would be important to give the list of schools. But you'll see in the coming days that we're working very hard on this. On the same topic, you mentioned two specific situations that could occur in the schools. In the second case, you talked about 2 cases. Well, when we have 2 cases that are connected in a facility, because they're people who are in the same class or had some sort of contact, whether they played together for more than 15 minutes, say, well, we consider that those are single cases. And that shows there's been transmission outside of a single individual. So then we get engaged in a more intensive investigation. 2 connected cases are enough for us to call it an outbreak. We're talking about the number of cases going up, but what about the mortality rate and people recovering from the disease? Well, the good news is that right now, yes, we're seeing an increase in the number of cases, but we're not seeing that in the number of deaths, which is very good news. There hasn't been hospitalization, but I think it's kind of a false piece of good news. And false good news, I mean, you may not like the comparison, but in the United States a few months ago, they were saying, oh, this isn't serious. We're seeing the number of cases go up, but they're young people, so it's not a problem. But that's not the case. So I think we have to be very careful and understand that that chain of transmission will have an impact if there's an increase in the number of cases, and that it could have an impact on the number of outbreaks, and the number of outbreaks will have an impact on the number of people who are seriously ill and go to hospital, and there could be deaths as well. That's exactly what we want to avoid. So it's good if we've been able to prevent that thus far, but we're not reinventing the wheel. In every other country where it happened, there was an impact on the number of hospitalizations, on intensive care units and so forth. So let's be very conscious of what could happen. And that's why I'd want to see the number of cases go down so that we can perhaps return to the new normal. Moving on now to questions in English.
We're going to start with the CBC.
Regarding schools, I know we're going to get the numbers later this afternoon, but you said there are about 30 schools, 20 or 30 schools that are affected so far. Considering the fact that we're only a week into the school year, considering the fact that it can take time for symptoms to show, and the fact that a big part of the province's plans doesn't require physical distancing within the classroom among students, do you think it's a bit premature to say that so far things are going well in schools?
I think this is important to reassure the parents that we're doing everything to keep this under control. What I think when we're saying that most of the school, and I think that what Mr. Massé has explained earlier, is that we don't have outbreaks in the schools. We have specific cases, and most of these cases, as you know, they were not originated in the schools. They were originated outside for people for students or teachers that had already the virus and then came to the school, right? So what we're saying is that situation is so important that we keep it under control, and that's the reason that we are very rapid with the public health to act on those cases. So to me, and we were ready, and we said that we were transparent with the parents that we would have those cases. So to me, what we've seen in the last week is normal and was expected. But the thing that we don't want to do is to wait until this increase a lot. And I think this is the reason we're giving this information as to what are the schools that are impacted, that we're not seeing an outbreaks in most of those schools. So I think that's the reason. I think we can say that it went well for the first week, but we're not going to lower our guards, that's for sure. And maybe Richard?
And you have to take into account the experience that we have from last spring, where really it went very well in the schools. That's what we were expecting, and now it seems to start the same way. So yes, it's soon, but at the same time, it's not different from what we've seen earlier and what from the other countries are seeing in primary, secondary schools also.
And if I may, we had reopened all the kindergarten, the CPE, since June. And you know how many cases in more than 10,000 of those facilities, if I include the CPE, about 100, over 100 cases in the last 3 or 4 months. So I think we know how to control those things within a school environment. I know those are for the younger kids, but I think we know how to do it. So it's something that it's really important for us, but I think what we've seen in the last week and what we've seen in the kindergarten, I think it's reassuring, and people, parents should think that we are doing everything to keep it safe in the schools.
Just a quick follow-up regarding personal protective equipment.
Yep.
Minister Dubé, what can you tell us about what's being done to ensure that there's a stockpile of PPEs available, not just for the next month, but also throughout the fall and the winter as we head into a possible second wave?
Yep. On that, we remember when we published our plan for the next wave, one of the 9 priorities, the APE protective were one of those measures. We have 2 levels of inventory that we survey. We have the inventory level, what I call at the establishment level. Okay, so for example, for schools or for hospitals, the establishment really it's close to the school or close to the hospital. But we also have increased what we have in the warehouse. Even right now, we are probably at 60 days at the level of establishment, but we have now at the warehouse level up to 6 months in those 5 different PE. So I said that there was one the other day that we were still working really hard is on N95. And on N95, we will have a Quebec producer, manufacturer, sorry, that will be finalizing the first mask by November, by the time we get the certification. So I think we're okay for all those EP.
Thank you.
Thank you.
And we'll go with Global for the final question.
Hello. So, Dan Spector from Global. I know you made it very clear about the announcement on Tuesday and how you're not going to give away too much now, but I'm just wondering about...
I already did a lot.
I know, it's great. But I'm just wondering, not in English, and I'm just wondering about what kind of conversations, what kind of research remains to be done this weekend, I guess, in anticipation of that announcement on Tuesday.
Oh, interesting. I'll give you an example of somebody I was talking to at the Manufacturer Association. I think they've done, in terms of protective measures, all the manufacturers, they've done a very good job early. Remember, we deconfined the construction, and then after we went to the manufacturer. And one of the suggestions that we're having with them this morning, saying, okay, but if you had to reconfine something, can you make sure that, for example, the manufacturer, the need of keeping the essential by region, because what I'm not supposed to talk about is supposed to be region-based, but if you go by region, make sure that a manufacturer that supply another manufacturer is taken into account. Those are the good suggestions that before launching our program, we heard from, I call that from the terrain, from those people right now, of those suggestions, make sure that we tweak our program before we announce it on Tuesday.
Dr. Massé, do you have any perspective on that, on just what kind of research analysis still needs to be done between now and Tuesday?
Well, we are going to look at the last figure for the last few days. So every day in the weekend, Mr. Minister knows about it. We are looking at the new figures, and as it's changing rapidly, so we'll make that up to date. So we have the very good data for our minister for this Tuesday.
And Mayor Plante spoke about it this morning. She sort of wondered what something like that would look like for Montreal, and sort of said that maybe Montreal can't have a sweeping regional distinction, and maybe there's not a one-size-all solution for Montreal. Do you have any thoughts on that?
We're talking to the mayor right now, so I'll keep that for Tuesday.
All right, thanks.
Okay, all right.
Merci tout le monde. Bonne
Merci
journée.
beaucoup. Bon week-end. Soyez prudents. Soyez prudents. Merci beaucoup. Merci.